Knock, knock. Hello. My name's Ruby. I'm going to be your student nurse for today. Okay. Can I have your first and last name? So this is going to be my patient ID band for today, okay? Can you tell me your date of birth? And do you have any allergies to medications? All right. So how are you feeling today? Not feeling so good? You feel really tired? Okay, so that's the reason why we're here today. So we're going to do a blood transfusion. And basically this is just going to help you feel better. In the end, it's going to give you the blood. It's going to disperse that oxygen to your tissues. And you're going to feel way better after this. Has the doctor talked to you about it yet? So then I would explain exactly what's going to happen. If he didn't, you're going to get blood for about an hour and a half to 2 hours, maximum 4. And we're going to assess you throughout. And if you feel anything weird throughout the transfusion, anything that just doesn't feel right, I need you to let me know, okay? Have you had a blood transfusion before? No. Okay. So we're just going to go ahead and verify that everything here is correct so I can get your consent. So William Bennett, date of birth 11/5/38, no allergies to medications. You're going to have A positive blood today, so RH factor positive. You are going to get 300 ml of packed red blood cells today. Okay, so making sure that the IDs match. Perfect. You can go ahead and sign right here. Okay, for the consent. Now that I have consent, how is your IV feeling? Do you have any swelling, any itching or pain around your IV? Nope, all good? Okay. So I have the IV right here connected. So, looks good. Have my alcohol here to clean it. And make sure to get some blood return and flush. Okay, looks good to me. There's good blood return here. Okay. Alright, so I have normal saline here that I'm going to be using. It's patent. The expiration date is good. There's no floaties in there. And I have a wide tubing set. So now I made sure that all the clamps are closed. I want to make sure to aseptically, I mean sterilely, take care of all this tubing. Alright, let's spike my normal saline bag. Okay. So before priming the whole tubing, I would prime the Y part first. So I would open this clamp, open this, and there it goes, it's primed. And then I would prime the rest of the tubing. The reason we're using normal saline is to prevent the blood cells from lysing. So I'm going to go ahead and prime the rest of the tubing. Opened, making sure that the normal saline is covering the filter completely. There it goes. Perfect. All right, we have that prepared. All right, so before I go, I'm going to get another set of vitals to make sure the patient's stable before I go get the blood. Wash my hands. And do you have any questions before I leave? No? Okay. So I'm here at the pharmacy now. I'm going to go ahead and talk to the pharmacist. about all the information, making sure cross-matching is correct. So we have William Bennett, date of birth 11/5/38, patient number PCS 11500. The ordering physician was Richard Jones. We're getting A positive red blood cells today, packed red blood cells. We're getting it for room 205 in the ER department. The unit number here is 000, perfect. Okay, RH factor, we have that. Volume to be infused is 300 mLs. Expiration date May 1st, 2020, so we're good. Okay, so I would go ahead and get consent from the pharmacist. Everything's good, that everything's exactly for this patient. When I leave, I'm going to go ahead and go back to my patient's room with another nurse to cross-match in front of the patient. So I'm going to look at the patient's band with the other set of eyes, making sure the same name, date of birth, room number, location, A positive, RH factor positive. We're giving packed red blood cells today. So the unit number is 000, the blood bank number is 0101, so it's from that blood bank. We're going to give 300 mLs. The expiration date is May 1st, 2020. The doctor that ordered this is Richard Jones. Everything looks good. The nurse will then sign with me, dual sign, I will sign as well. That she's going to witness that. Now that I have my blood, so once I got that blood, I have 30 minutes to infuse it, so I would immediately go to my patient's room, hang my blood. I would ask the patient, do you need to go to the restroom? Any needs before we go? Okay, good. So making sure that this has no coagulation, that it has no darkening, because that would indicate that there's bacterial contamination. I would agitate the blood, make sure that it's suspended. The expiration date is good. This is the correct blood. If I had any labeling, I would put the stickers on. Everything would be done before I do this. And I would get a set of vitals 5 minutes before I do this to get a baseline for the patient. Okay, now that we have this, the clamps are closed. I want to make the blood go all the way to the tip, making sure that the filter is completely covered. And when it goes all the way to the tip, I would stop it, then connect it to the patient and the pump. There it goes. Okay. Have my alcohol, clean. There it goes. So now I'm going to have it connected to my pump. I'm going to put it at 50 mLs per hour for the first 15 minutes. I would stay with the patient. I would get the vitals 5 minutes, 15 minutes, 30 minutes, and every 30 minutes until the infusion finishes. It should take an hour and a half to 2 hours. If we're going to be giving 300 mLs, I'm going to then, after 15 minutes, if the patient does not have any signs or symptoms of any type of reactions, I would then increase it approximately to 150 mLs per hour or so, as a patient can tolerate. Signs and symptoms that I could look out for are probably restlessness, feeling shortness of breath, having skin flushing, increased heart rate. Something just doesn't feel right, I'll listen to them and take another set of vitals. Immediately stop the transfusion and notify the doctor. I will re-verify all the identification checks just to make sure I didn't do something wrong. Go straight to the pharmacy, give all the blood, make sure that they can do a culture. Maybe something went wrong there. I would maintain patency of the IV site and do NS, so normal saline, whole another tubing set, whole another bag. And yep, continue to assess the patient. Some allergic reactions that could happen, anaphylaxis, allergic reactions, febrile reactions, cardiac overload, so a taco. I would then assess the patient as according, and if the doctor wants to give any medications, I would do per doctor's order and treat that. For documentation, I do want to document the indication for why I'm giving the blood transfusion, what I'm giving. So if it's packed red blood cells, I would put that. 1 unit of packed blood cells, 300 mLs that I'm going to be administering. I'm going to put the rate that I put it at. So if I put it at 150 mLs per hour, I would put that on the documentation. What blood type it was, A blood type, Rh positive. I would then put how the patient tolerated it. No adverse reactions noted. I would put the time, the date, and my signature, and a set of vitals that I was taking along the way. Also, when I was assessing the patient's IV, I would make sure that the patient had an 18 gauge IV for this blood transfusion. So that's about it. Thank you.